So today we're talking about something that actually going to affect a lot of us in the U.S. The U.S. healthcare system.
Mm,
There are what we're typically used to seeing is basically not the value-based care that is trying to lean towards, but pay as a service, right? You go for your exams, you go for any tests, you visit your doctors, and you pay whatever fee is
copay
associated
or
with that
whatever.
visit,
Yeah.
right? But there is this new trend that is leading towards value-based care, and
What is that?
the
What
U.S.
is that
healthcare.
exactly?
It's basically there is an effort in going around and limiting the number of tests that you need to do because there is a lot of focus on preventive care. Preventive care basically seeing you as a whole to prevent you from getting big diseases or big issues to limit the amount of cost that might be. And not only that, let's say, so that it's very results oriented. If someone got sick, right, did the doctor actually heal the person, like prevent them from, diagnose their issues properly, give them the right medication so they're not readmitted. So value-based care is from a patient side, you can say, did they heal up? Not did I run these tests, did I run this blood work, how much did I charge? But did they heal? Are they coming back? How often are they coming back? Uh,
But how
so
but
it's
how would
not
they it sounds promising. Yeah. But how would they how would they measure that? Would they measure success?
so that's the topic that we want to talk about, right? So we want basically success would be seen by how often is that same patient coming back for the same symptoms, for the same problems, right? How and if they are not coming back as often because we properly diagnose it, then there would be savings for the doctor side as well, right? To say, or they will be incentivized to say, you're going to get paid more. The insurance is going to pay more because you actually helped prevent this problem or this patient having the problem. Um, so
But
I'd say
how does
that's
that
the key benefit.
but how does that help insurance companies? Because insurance companies benefit the more you come, right? And the more they can, you know what I mean? Well,
Well,
not the more they pay
there's
out. Like how
different
did
parties, right? There's the insurance parties, there's the patients, there's the doctors, right? And Medicare is basically what's driving a lot of push towards this value-based care. Uh, it's the government, right? The government has an incentive to lower the cost. And the US healthcare spending is over $5 trillion a year, about 18% of our GDP. So it's overinflated, it's too costly, it's not maintainable, right? And because of all of these situations, they're trying to find a system, a way to lower the cost, but in a way that's meaningful, right? Instead of you going to the same doctors 3 times, like different doctors throughout the year, but let's say you have to do the same blood work, right, all 3 times. Instead of going for diabetes, pre-diabetes check with someone, a cholesterol check with someone, a physical check with someone, there's this sort of effort of like an organized care system where they say, all right, go do it once and get all the tests done so that you're not doing multiple runs of the same test.
but then
So
I
some
mean
people
things
are
change.
winning. Go ahead.
Right, but things change, right? Like people's symptoms, and I think the reason why they do the blood work, and I'm one of those patients, where it's like over time things change, right? With your body, with your blood work, with your diabetes, right? The A1C and all that stuff. A lot of these change. So wouldn't it be? How would that be beneficial if I'm taking blood work only one time? And a year from now, like I take it again, like within that time so many things can change.
I think it's not the idea about the value-based care system is to stay away from doing repeat tests, multiple tests that multiple providers might be doing within the same time, and no one having that sort of linkage to say, oh, this person already did it, why am I reordering? So it's from an efficiency perspective, but that doesn't mean that if you have a symptom that's coming up, that's new, that's chronic, where it requires you to go do those tests, that you can't go get it done again, right? It definitely can be done if there's a need for it, right? So it's not to sort of say no, you can't get extra tests done. It's more so, is everyone aligned, right? Because there's sort of a managed care system that will need to be implemented to say across the spectrum, does this person need it? There's advantages and disadvantages in the approach. Um, but I guess let me know what other like concerns you think you're seeing with such a system.
I mean, yeah, well, not concerns, right? Like I see it working in one way and in one scenario, but I also potentially not seeing it working, which is the scenario that I was giving you. It's like, you know, I go to the doctor, right? Maybe 3 months or 6 months or whatever. I don't want to just do one blood, and I understand the concept of efficiency, but I also think there's a play of effectiveness. Right? Effectiveness comes into question. So I think it's more so efficiency versus effectiveness. So I see the efficiency part, but I also see where there could be lack of effectiveness because if things change with our body all the time 24/7, and I understand like we go to different doctors with different things, but I also think that maybe there's a chance of what one doctor may not consider um, an issue based on your blood work, another doctor may, right? Because it could be relatable to a different organ in your body. And so, like, I think this is a more case of efficiency versus effectiveness. So I see the pros and the cons at the same time. I don't know. I'm like kind of in the middle.
Yeah, no, there's definitely going to be trade-offs, right? And that's always going to be a concern with any new system that's going to be implemented, right? Currently, for the elderly, Medicare is 52% of elderly are already on this value-based care system, and where it looks at, okay, readmission rates, chronic rates, like how well are they maintained, and so forth. The bad outcome might be that a doctor feels that their judgments are getting undermined, right? Like, well, I don't want to think about, you know, cost when I want to do a certain test on my patient because I feel that it's really necessary, right? So that would be one of the disadvantages if the primary focus of this is cost savings, right? And that's sort of the dilemma that would be faced with this sort of situation. So it needs to be, I guess, implemented properly where, the sick patient, someone that's chronically sick, isn't overlooked, right? To say, oh, I'm not going to order this test for this person because XYZ reasons, especially when they need it. So that's a fair concern. But it also incentivizes, I guess, doctors from not performing the same test over and over again just because it's a paycheck, right? It's an extra bill that they can charge you. For example, I sometimes do certain tests and with the doctors, and I'm like clueless as to like why did it what are these extra line items that I'm seeing in my bill that I didn't really ask for, as well as like the dollar, like the value, right, the cost of each of those line items. So if it
Yeah,
means
that's
that
a
our
it's a
bills
different
might
conversation.
from a patient perspective go down, I don't mind.
Yeah, I mean, but like there's an opportunity cost, right? Like, I mean, how much really there's the whole concept of the trade-off, which is what you just mentioned, which is like, okay, yes, the cost of the bill may go down, but then also the service of it, like what kind of, you know, for this to truly work, there has to be buy-in, right, from all kinds of doctors and stuff. So it also the trade-off might be, yes, the bill might be lower, but the other side might be, you know, not as effective doctors. Again, it goes back to the efficiency versus effectiveness, in my opinion, because lack of there's so many areas for a lack of efficiency, a lack of effectiveness. I mean, I'm not trying to like go back and forth with you on this, but I like I'm just thinking it through, right? Like I see both areas, and I don't know. I mean, yes, and I didn't know that what you just said. I think what 52% or 50% of the
Yeah, so
elderly
50% of the elderly in the Medicaid systems are
are
uh,
already on it
on this value base. It's not like spoken about like out loud, but that's definitely one of the
publicly.
cases. Yeah.
Okay,
Um,
yeah, I didn't know that. And I'm thinking like, is are my parents on it, right? And then if you if what you're if like you know what you just said is if it's true, then I mean, I guess there's no change. I mean, I guess it makes sense what you're saying, right? Because I'm not seeing any changes with my parents who are elderly, um, versus like versus me, right? Like where I'm like kind of comparing between their care versus my care, and obviously
right.
it's a different dynamic because they have so many different kinds of issues. But in terms of the care, the value based care, maybe I guess now that you said that, I don't see the difference. So maybe the case for like lack of effectiveness might go out the door. So like now I'm like kind of biased, right? Like, I don't know. I'm trying to see
I'm
where I
sure there's like
think
internal
of that.
metrics within the hospital systems that the doctors are being assessed by to say how often are your patients coming in, right? Being readmitted, right? You release them, giving them this medication. Within 30 days, they're coming back. What's going on, right? So I think it might be a way where it weeds out, good doctors from bad doctors. Who knows, right? With these quality metrics. I, for one, for example, have used ZocDoc, uh, and I don't know if you
How
remember
is that?
my professor
Yeah,
back in the
yeah,
days, right, where
yeah.
you went and looked up professors and their
Best
courses,
professors. Yeah,
and you saw if they were like, really bad professors, right? And then you ended up trying to not choose their coursework, right? Because like, I'd rather avoid a difficult professor that doesn't teach well or whatever the case might be.
it's hard. Yeah.
Maybe has a difficult, communication style. So imagine something like that is created, right, internally, and maybe even through sort of there's this concept called accountable care organizations, ACOs, that will need to be created if this actually gets fully implemented, that will monitor the quality of the doctor, the quality of the hospital, the facilities,
Mm.
and based on all of those metrics and the patients, right? Like it may not just single out each individual patient, but a group of patients to say these patients deal with diabetes problem, these patients deal with like asthma problems, whatever it might be, and then see on average, is there an improvement over time in this sort of group of individuals? Um, so it
Wait. So
could come down to
what's the name of the organization you said?
accountable care organizations, ACOs.
Okay, and is that
So that
like
these are things that are happening that need to happen, I guess, from a transition perspective to implement this value-based care system.
got it?
But yeah, so as you said, like it's already taking place behind the scene. A lot of people already on it. We just don't know, but I'm sure doctors and people within the industry um, are being exposed to it. And it also can come down to like from insurance, right? Sometimes insurance don't want to fork over costly MRIs, costly X-rays, or whatnot because they want to make sure that doctors or whomever has taken the right, have done the right assessment before picking up costly examinations. So even they have some,
But
some
I don't.
reasons to embark into this.
Yeah, the thing is though, I don't think it's. But insurance only comes into play when the doctors put in the codes, right? Like I think
Yeah.
insurance. So like I don't think insurance has a problem billing. I think it because it all comes from the billing comes from the doctor, right? So I don't see where the insurance would have issues
Well,
with that.
insurance don't want to pay out, right?
Uh,
Or
do
doctors
you
will
think that's a
bill the insurance companies to say, I provided $10,000 worth of services, but insurance only wants to pay $2,000, right?
but you mean when you say payout, like do you mean pay out the bill on behalf of the patient or pay out to the doctor or the office?
Well, on behalf of the patient, right? So if we have insurance as individuals,
Yeah, yeah,
right?
okay, I see what you're
And
saying. Yeah.
when the doctor charges the insurance charges us, they have to go through our insurance, right? So if the charge is $10,000 worth of services given to Hira, right, the insurance will say, well, we have a pre-negotiated price plan for these services that you provided, doctor, and our negotiated price is 2,000. So even though you might have billed 10K, we're only going to pay out 2K, and that's it, right?
The rest is on the patient. Yeah.
So if now the insurance has more reasons in terms of quality metrics and whatnot through these ACOs, they might go ahead and be able to say, well, this is what since you're doing a good job, they might actually pay out more, right? Versus if you're not doing a good job, maybe they might be incentivized not to pay out as much. But jumping to the next thing, right? It's not, I guess, all, how many patients are being readmitted. It also, there's an AI factor that is going to be placed in this and is already being used to some degree, where
I was
it
gonna ask
might
about that.
come up
Yeah.
with suggestions. Yeah. It might come and provide suggestions to say, hey, based on the history of these group of patients, this is typically the path that they should take in terms of medication, in terms of, next steps, in terms of surgery, services. So there are things to, I guess, benchmark against and evaluate against. What are your thoughts, I guess, behind AI being used for these sort of services?
Well, I got a lot of thoughts. I'm glad you asked. So I think that's good, right? Because I think that can prevent a lot of illnesses, a lot of issues in the future. I'm curious to see how AI is going to play a role, right? Like in the future of healthcare. Just like we're seeing that nowadays, like you have automated tellers, right? Where it's just AI tellers. Like you don't need to go to a physical person anymore. It's just an AI kind of. I've seen in some of the banks. I forgot which banks it is, where you're talking to the AI and AI is like doing everything for you. I think in the future, and I'm going far off this topic, but I think it's somewhat relatable. I think in the future that we may have AI doctors, right, that are far more based on the data points and the data that's captured over the years and the trained models that it has. I think AI is going to not just assist with the medical, issues and illnesses and help diagnose. But I think it's just going to give the full spectrum, and it can kind of tell you, like, based on this person's current profile, medical profile, 20 years down the line, this is what's going to happen to them. And obviously, it's going to pull like billions of data points, right? And I think we're going to have to rewrite the rule of HIPAA, right? Like, because HIPAA is, kind of like the middle ground for what's the word? Not like policies, right? And things that you
Yeah.
can kind of approve.
Yeah, we don't want basically any actual patient information or identification in these sort of systems. So they have to be anonymized, right? Remove our private identities so that way it's not abused and misused.
Yeah, yeah. I mean, and that's a whole different conversation, which I think there's going to be some kind of policy around it. But I mean, just to answer your question, yeah, I think besides the assisted part, which I think I think it's great. I think it's just gonna go far beyond assisting. I think it's gonna take over, and we're gonna have AI doctors. And some people may like it, some people may not like it. And I think where I see technology heading and how fast it's heading there, I think we're gonna end up very soon within the next 10 years. I want to say 20, but I don't think in the next 10 years. Um, I think AI is going to be able to like just scan you or fingerprint in some way, some shape or form. It's going to be able to like tell you what blood work you need, right? All of those things and what's coming up down the pipe. What are some of the possibility of illnesses based on, your current blood work and all these things. And yeah, so I think we're heading down that path, but I think the assisted part is pretty good. I think I'm
Yeah,
for it.
I think I'm very big on AI as a support system, right? So maybe, it could run through 1,000 X-rays of a messed up ankle or messed up knee and be able to pinpoint like, well, this is where how much the damage is, this is how much the tear is, right? And based on thousands of images that it reads through and has analyzed, it can go and say that this is the best, surgery that you might need to apply or the best technique that you might need to apply to address, whatever problems. So as long as it's a suggestive tool and not replacing doctors, I think it makes sense, right? It can only help. I think
But you don't
that's
think
a
that's
big
gonna
part of it.
happen? You don't think it's gonna replace at some point?
I feel like it's gonna be like how we're using ChatGPT, right? To just self-check, maybe just self-check to say, here, what's the second opinion, right? It has to be a second opinion because at the end of the day, every AI model could at some point in time spew errors, right? Spew the wrong information. So if someone doesn't audit that response and validate it and say, yes, I agree, imagine the AI, gives the wrong medication to a heart patient or some other patient that is
But
not
that's
really
what.
connected to them. That
Yeah,
the
but that
doctor will need to review and say, oh yeah, this makes sense. It wasn't a machine error. Yeah.
I disagree with that, and I'll tell you why. Because that's what waivers are for, right? That like just like we go to, you know, trampoline parks and stuff, you got to sign a waiver and say, hey, we're not responsible. I think I think a part of it is going to be like, hey, if you want to use, I think there's going to be a human element to it. Like you might be able to see a human doctor within the next 5 to 10 years, but I think beyond that, I don't know if there's going to be human doctors anymore. And I think what's going to happen is Gen Z and all these new gen people that are coming up, they're going to be like, oh, I want to go to an AI doctor. It's faster. It's probably going to be cheaper and it's going to be more accurate, right? The chances of being more accurate. Yes, there's going to be a margin for errors. There's going to be room for errors, but it's going to be probably low. I see that as like, I see it as potentially replacing doctors because the same argument can be said about human errors as well, right? Like yes, computers and AI models can make errors, but humans can also make errors, and so there's going to be a case of like, well, there's 50 different cases that are where the hospital, the doctor is being sued because of human error, and I think that's where AI versus human is going to come into play, especially around healthcare.
I definitely agree in the sense that you might need less doctors, right? So let's say on a typical day, one doctor can handle 20 cases. I'm just making that number up, right? Well, now with AI, maybe that doctor can handle 40 cases, right? So you basically doubled his workload because it can pre-screen the patient's symptoms, the diagnosis, ask a bunch of questions to the patients and say, here's my, diagnosis. So from that perspective, either you increase by reducing some of the workload of the doctor, you increase his output, right? Or you can go the other model and say, well, I don't need 10 doctors in this facility, right? If my workload is always going to be 100 cases per day and I needed 10 doctors to do the 100 cases, well, if AI can cut that in half, I could drop half the doctors, right? So it can also go that way where, as you're saying, replace or eliminate some of the doctor jobs because now AI is going to be their assistant. But I think that's a situation, right, that we're facing with all of the industries. And I guess going to my point of you're always going to need a sign off from an official doctor because a machine, no one I think will accept a machine saying this is the final prescription. The machine signs off on it, right, to say this is AI doctor, whatever. And I, at least personally, I will never take a suggestion from an AI doctor and say, I'm going to just take the prescription, no question asked. I think I'm always going to need a human element to say, did a doctor check this machine based answer to approve, like, finalize or sign off on the prescription?
But
Yeah, and
I'm
similarly,
curious.
yeah.
But I'm curious. So do you not ever see AI replacing humans? Like I'm thinking in the concept of assist versus replace. So do you not ever see like that happening, and where we're not gonna? Do you not see that's where we're going? Like AI is supposed to
As I
replace
said,
humans?
doctors will get replaced. If speaking about doctors in this case, right?
Yeah,
If you needed
yeah.
10 doctors to handle 100 case, now you might need 5 doctors to handle 100 case because the AI is going to be able to
Right. But you're talking about a
appreciate the
hybrid
input
model.
factors, right?
You're talking
Yes,
about a
well,
hybrid
yeah,
model. I'm talking about complete
you're
replacement.
no,
You don't see that happening
I
in the
don't see
next
that
20
ever
years?
happening. At least not in this particular field. It's such a sensitive field. that
No,
I
okay.
don't think you could eliminate the human element.
You see a
And
hybrid
same thing, like,
model, but not a complete
yeah,
replacement.
no, like at least I don't foresee it. This is not like a manufacturing plant where you're making an iPhone or making
No,
your
I get
clothes
it, but
where,
like,
yeah.
no, I get it, but like the thing at the same time,
But you
sorry to cut you
actually
off.
think you don't ever need a doctor if you, like that's how
No,
far it will go?
I know as a human. Well, first of all, okay, let's. If you guys are watching, this is clearly where this is a topic we're passionate about. Like, how many, really and truly, how many of us, right, with the healthcare being expensive, and this is exactly why we're talking about this. How many of us truly go to the doctor as often as we need to? Right, because of cost, because of time, because of work and all these things, we don't we're allowed, I think insurance pays, correct me if I'm wrong, pays for one physical a year or two physicals a year or something like that, right? Like
One
we only
annual,
go for one annual, right? That's that. Like
yeah.
in a whole year span, there's so much happening to your body over the course of that year. I don't think one is enough, right? And then you go to doctors when something serious happens. Otherwise, you typically don't go. So to answer your question, if I'm already going only once a year or twice a year, then I mean, like, and then me, and we've complained about this actually in our friends group chat. I'm sure all of you guys have a friends group chat in the past where it's like insurance is charging us so much. Like, I don't know what they're charging for, right? They're charging an arm and a leg, and we barely go or we barely do anything, and they just don't, it feels like they like see how you're doing. Like, you go and tell them what the symptoms are, and then they just say yes, and then sign off on a prescription. But like, I think this might be controversial. I think AI can. I don't want to say this, but I'll say it. Don't cancel me. I think AI can, at some point in the future, do a better job than humans. Now, does that mean that AI cannot make mistakes? Does that mean human cannot make mistakes? Any argument you go against AI, I'm going to come back here with humans. If can AI make mistakes? Absolutely, but humans also make mistakes. Can AI be better? Absolutely, but humans can also be better, right? So, like, my thing is, I think at some point, like, I want to go to the doctor and be able to, for the doctor to be able to tell me, because right now they're not doing this. Like, hey, this is where you're currently at in terms of your health. This is what the projection looks like. And most doctors can, right? They can tell you, like, if you continue, with your diabetes as high, right? Like, you're gonna eventually die. You're gonna lose an arm and a leg and stuff like that. But I'm not talking about that. I'm talking about like this is what we're seeing in your blood work, and like this is exactly what's going to happen. Not 100% sure, but at least like 90 to 95%. Like, this is what we're foreseeing at this particular age. I want real time, factual, as accurate as possible data when I'm going to the doctor, so then I can make so that today me can work on the 10 years me in today. Does that make sense? So like the 40-year-old
Yeah.
Shaquille can prepare for the 50-year. I just gave my age away. Shoot. The 40-year-old Shaquille can prepare for the 50-year-old Shaquille today. I don't want to wait till I'm 45 to prepare for 50, because by that time I'm going to be like, it's going to be too late. I'm going to do a lot to my body within those 5 years. Does that make sense? Or did I lose
Yeah,
you?
and I think that's one of the key things about this value-based care system that we're talking about, where it's using AI to see those patterns across people that have these symptoms that you're facing, their age, their demographics, right, the location, and there's a heavy focus on preventive care, right? So that way the 50-year-old you doesn't face the issues that people that didn't have this value-based care system in the past do face, right? To say, well, the doctor just kept on ordering the same test every year, right? There wasn't, and they charged the insurance company, they got paid, right? So it was just, fee as a service. You billed, you got your money. So whether or not the patient actually healed, no one really cared. Um, but going to your AI point, yeah, I think that's the power of AI, where it's going to be able to crunch the data across the globe, across hundreds of years, right, on medical science and techniques and tools, and be able to actually give you, as you're saying, better answers than doctors can give, right? Imagine like the top surgeon, you take the hundreds of the best surgeons of the world and dump their brain into AI, and now it's able to say, this is what you need to do, right? And not only just give answers, but also use the precision, right? Like surgeons have to be doing surgery like 36 hours, and there's fatigue, there's tiredness, right? Energy, etc. So now imagine a machine doing this precise with no fatigue. So there are going to be revolutionary changes where do I see doctors, getting replaced? Yes. But I don't think you could, at least my opinion is you can never remove the human element, right, of things. Where the human element being like, all right, I could do everything through a dashboard, through a virtual meeting, through AI, punching in my symptoms, but my final verdict would be good to have a real person say, okay, I agree, right? And as you're saying, everything does make errors. For example, if I'm just talking about electric cars, right? Um, there's always that manual override that the driver has. What if the car just goes haywire and starts doing 100 miles per
Yeah,
hour? What's the
but but
pause brake, right?
but the thing is with that, right? So the system is designed. Every AI system is currently designed. The model that is currently at is designed for a hybrid thing, right? Where a human is in touch. A human is available
Yes.
to right the wrong. But I think when flying cars come, electric flying cars in the future and things like that, there's gonna be. I don't think the humans are gonna have that. You understand? Like I don't think humans have any are going to have any help with that. For example, there's a company called, I think, I'm sure you know about Waymo, right? You've heard of Waymo, right? Like, and I went to San Francisco, it's the car's driving by itself, right? And so, like, at that point, I don't think the passenger is able to do anything, right? So, like, my point is, that's my point. So, like, autonomous cars, right? And, like, so I see that happening as well on the AI side for doctors. Like, there's not much, you're on the operating table, right?
But you see, the safeguards they put on that is slower
There's
speeds,
accidents, by the way.
right?
Yeah, but there's
Huh?
still accidents that are happening with those cars. So like the
Yeah,
the, the
slower
person, the
speeds,
passenger has no
accidents are
control.
happening. But the accidents are not, I guess, as fatal, right? I assume because they're going slower speeds. But yeah, as you're saying, if you're basically saying if you put enough safety,
Protocols and measures.
and
Yeah.
protocols around it, then you could potentially replace.
AI, which is exactly what's happening with taxis, right? That's because now what they're seeing way when I went to San Francisco in the past, they're saying that like the accident rate is lower than what a human with a human, in terms of like driving and
I
stuff as
haven't
a
looked
taxi.
into like there has to be like a kill button or a stop button from like somebody in Waymo that says if this is, or even like the passenger to be able to click like a power off button, I would assume.
No,
If
no,
things are
not
going crazy.
no. So there's lawsuits around that. We're not gonna get into any of that. But like there's so the passenger has zero control in the car. Like that's you. I don't know if you. I don't think you signed
Oh,
a waiver and
like
stuff
when
like
you're in the
that.
elevator and there's like pull alarm, pull
Yeah,
alarm
I don't
thing.
think. No, there's
Like
nothing like that
something just
on the
signals to
car.
Waymo like, yo, I'm about to get crashed into the wall. Stop this thing.
Y- Yeah, I think the AI model or like the model that they built, I think it either self destructs or self like prevent. Like I'm sure there's preventative measures by itself, like this programmed that way. But I'm saying that the passenger has zero control. So like this is a complete AI driven car. Like it's all and maybe it's AI or whatever you want to call it, but it's complete. Like the passenger has zero control. What I'm saying is the same concept, thought process and concept on the other side, on the medical side. I think the AI doctors will completely. There's a case to say AI doctors are going to be much more better than human doctors, and obviously that's debatable. But I'm saying that there are, if we can do it with cars, we can do it with doctors. That's the case that I'm making.
I mean, when you use that example, I could see like it getting there, but I guess I don't know. The human
Eh,
part of me says that
I know,
there'll be a lot of rebellion against that
sure,
notion
but
of
you know,
like, imagine you going to an AI judge, right?
yeah, that's just
You're a
gonna happen.
criminal,
Yes,
and now this AI, and you have
but there's a
evidences
movie.
and all this stuff,
Oh my God,
and
what's the
you're
name of the
literally
movie?
getting sent to prison by an electronic machine judge,
Hold
right?
on.
With no actual human, and not even, and we have the jury, if I'm talking about, like, we have a jury-based system, right? Where they
Okay, hold on. I'm sorry. I gotta cut you off here.
imagine going to
The
jail because
the
of
name
an AI judge.
the name of the movie is called Mercy, by the way. That exactly it's a movie and it's
Mercy?
gonna come reality. Mercy. So like it's a AI judge, and so what happens is I'm telling you, watch the movie if you haven't watched it. And for folks that are watching this, watch the movie Mercy. So it's an AI judge, and the judge, it's crazy. You gotta watch it. I'm gonna give you a high level. So like it's in, oh my god, how do I even explain in layman terms? Okay, so the AI judge is not just the judge. So like it's the judge, and they have all kinds of data from all over. So the guy basically, um I don't know what he was. He was an attorney or he was something. I forgot what he was. Oh, I think he was a cop. And then he got into put into trial. Somehow he woke up, he went to a bar, he doesn't remember what happened, he blacked out. And then they put him on trial for murder for his wife. And AI, and so he had to
Don't give
prove
away
to
the
AI.
ending.
Okay,
Don't give
sorry.
away the
Long,
ending.
long story short, he had to prove to the AI judge, and the judge also like was also kind of like a jury, I guess, in a sense. And so he had to prove, and like, but the defense attorney, so it was like multiple AIs. The defense AI was helping him, and but he had to like put the pieces to the puzzle together. He's like, "Oh, I need you to show me this. I need you to show me this." Blah blah blah. Long story short, I'm not gonna tell you the ending, but it was insane to see it unfold and how they really like put it all together. So I say this to all say to kind of what you just, and I apologize for interrupting you, like that happened in a movie, and I 100% see it happen in real life. But you gotta watch the movie. Like I'm telling you, like let's revisit this conversation when you come back and say, "Listen, I saw
I
this
don't
movie."
doubt you. I feel like if there are no, this whole debate about ethics, right? You'll see a lot of that is being debated within our government, within our politics, within even corporations to say we want to build ethical AI models, right? So that way it doesn't do something that ends up being dangerous, that there is no safeguards, there's no policies, right? And is it ever going to be capable of, is AI ever going to be able to implement all of that so that way people are able to trust it and its decisions to say, I'm okay with that? So in a utopian type of world, I feel like people would accept the outcome, like of that movie or of, an AI doctor that we're talking about, right? If those safeguards are tried, tested, and proven. But knowing, I guess, the reality of the world and how corruption, greed, or whatever might come in to the mix, right? Always will cause at least me and maybe others that hesitation to say, can I trust this model based on whatever internal mechanisms that are placed in it that might, let's say, prioritize profit or and cost savings, right, over the best quality for my patient, and then having another real person be able to go like, you know what, there are alternatives that are better to check and challenge that. So no, I think yes, that is very possible, and it could be like that if the world was a more trusting environment. But I don't know. Personally, would you be okay with that? I guess that's what it comes down to. Not that it can't be done. I think anything can be done, right? But look at, electric vehicles have been out for maybe 10 years now, and still we don't have an autonomous, other than like Waymo and so forth. It's not widespread. Like what's taking over 10 plus years, 20 plus years, where we have the tools to implement it, not happen yet because of all these check and challenges that people are saying, oh, it's not that safe, right? Or how
Yeah,
are we going to deal with the situation if this happens?
I'll tell
Personally,
you
would you
why.
be fine with it? I guess that's what it comes down to. Would you be fine with an AI judge or an AI doctor to give you your final verdict and say, all right, I'll take it, no questions?
Yeah, no, I personally would not be, but I do see that it's happening within the next 10 to 20 years, unfortunately. When I say
Let's
10
see.
to 20, I'm more closer to 20 years probably. And the reason why I'm saying that now, earlier I said 10 years, is because with human beings, humans don't like change, and they take the adaptability rate when it comes to change. It takes a long time for humans to adapt to a change, and so because of that, unless it's forced upon you, so like EVs are not forced upon the consumer yet. The minute it gets forced upon, which by the way, it is starting to get forced upon them. I think come around 2029 or 2030, there's not there manufacturers that are going to stop producing gas vehicles, and they're going to only produce EVs. So I think
In the
the
US
government
target.
in the U.S. I think it's just U.S. So, but my
Unless
point
they'll
is,
rip that apart, but I don't know.
no, no, it's still there. I think Ford is one of them. I might correct me if I'm wrong. I might be wrong. Ford is one of them where they said, hey, we're going to stop producing gas vehicles.
Right.
I think 2029 to
Yeah,
2030.
certain companies said that they're gonna just do it.
Right, which in turn tells me that in the next 10 years that they're going to force that upon you, right? Like you'll have no choice. And that goes with everything in life throughout the history of mankind. That goes from getting the first telephone, right? And then that goes to, the computers, right? When the web first came out, people were not going to like do it. When Uber first came out, I saw a video where taxi drivers were like, "This is crazy. Uber's never going to work." Now, yellow cabs are essentially non-existent, right? And Ubers and the Lyfts of the world is what's driving people around the world. And so I think once it gets either if it gets forced upon you, which I think will happen at some point, people will have no choice but to adapt to it. And the way human beings are and the way our minds are, we are going to adapt to it. At some point, we may not like it, but we're going to adapt to it. And then, or if it's not forced upon you, it's just going to take a longer time to adapt, right? Like over time, which is what's happening now. I think with EVs and with AI doctors, I think in the beginning it's going to be a hybrid model, and everyone's going to love it. Like you're saying, oh, like at the end of the day, I want a human being to sign off. And I think because I don't think the government's going to force that upon us in the beginning. I think they're going to sell it as oh, this is like an assistant model kind of thing versus a replacement of a doctor. And gradually, when the LLMs do more work and all these things come into more play and there's more models and the AI systems have more data points, gradually they're going to phase off the humans and you'll see more of the AI because what they want humans to do is start getting adapted to it, right? And so once you start getting like have that trust factor, it comes back to what you were saying earlier. And a lot of these Fortune 500 companies, a lot of these companies are focused on the trust behind the AI. So once you build that trust with humans, and you trust that AI model and you trust that AI, I think eventually you will adapt to it. But I don't see it's
Yeah,
going to
I
be
think the
forced upon us. I think it's going
accuracy,
to be adapt
right?
to it.
Right, the accuracy, the results are what's going to drive adoption. Um, but like, for example, knowing that I don't have full control of my car and is, losing that sort of manual driver capability of just taking over and that's being forced upon, I think there's always going to be a party that's like, no, I want my freedom. I want my. Imagine all you have is a dashboard that you have to click on for your symptoms and your diagnosis, and you actually have pressing questions that you want to ask, and now you have to like type it up or speak to a system, right? And it's just being very, robotic, right? Robotic, like where's that human touch or feel going? No, I want to be able to get that human interaction and express what I'm going through, that we sometimes do, right, with actual people, to feel like, oh, they heard me out and they're gonna help me out. So
Of
I
course,
think there's always
but
gonna be
even
some
but
parties like I want that human element. I don't know, but yeah,
but
right. Like
even, but even
when
now, here,
regulations are
right?
forced upon. Hmm?
Sorry to
Go
cut you
ahead.
off, but even now, like back in the days when before we had phones, what did we used to do when we want to interact with human beings?
Yeah, we met
Right,
up.
like
Now it's
we
texting.
would go see, right, no, but then it shifted to at that time texting wasn't around as much, right, and it wasn't as popular. There was beepers, right, and then you moved on to the beeper, and then you got a phone and said, hey, blah blah blah, and then it moved on to the actual phone where you started calling each other, and now we barely call each other, right? Now it's just texting. So I think if you look at the history of technology and electronics and mankind and you follow that trend, you'll see we're interacting with each other less and less and less. And so at some point it's going to be, well, we already like they're going
I
to
guess
sell the
as long
story
as
of the
there's
trend.
customer service. Yeah, I guess as long as there's customer service, or you could reach the customer service, right? I think that's the key thing. If if you're unable to reach customer service and actually talk to a person because let's say the system isn't working the way it's supposed to, or you are an anomaly, right? You have a disease or you have a concern or issue that the robot isn't giving proper answers to, and it's a chronic thing that keeps happening. As long as there's some sort of customer service or reach out, I think that might be a mini hybrid element that remains, right? I hope at least. But yeah, like I guess right now, one of the questions that can be asked, right, is going back to this current healthcare situation. Would you rather have efficient models that give you precision and say these are the tests you need to run, and there's this element of cost savings, or would you want the model where you want everything is possible, inefficiency is not a problem because you want to run all of the tests that you feel like are necessary for you to get the right answer. So if you were to choose between one or the other, efficient, precise, cost-saving stuff where it says you do only these two tests, or would you want the full spectrum of running all the tests to say, you know what, I want a full-blown assessment of what's going on? Where would you be leaning towards?
I would lean towards a full assessment as of right now.
Even though it might be inefficient and more expensive.
Now, I'm talking about like right now, but in 5 years, I might change my mind. But now, because I want to be able to, I mean, I see what you're
Because
saying.
when AI
Yes,
comes
it's
in, it's
still,
not going to give you that full assessment. It's just going to say, this is the pattern I see. You're just one little, dot across a million people. So you got to do
well,
this, and you can't do that extra test that you might want to do.
so okay, here, I mean, this is gonna, we're gonna, this is gonna be a lengthier conversation. I disagree, and I'll tell you why. I went to a conference, a couple of years ago, and let me tell you what they had. It was a healthcare conference. And so, you know those machines at the airport where you got to go through, you got to put your arms up, right, and it scans your
Scanner?
entire body? A scanner, right? Well,
Yeah.
yeah, it's late at night. So it's a scanner, basically. And so I saw there was a prototype that was built. I think it's already in production or something for a company. I forgot what it was, where they built a scanner and it's built for hospitals. And so when you go through part of your, when you go to the triage, nurses triage, you go through that scanner and it gives you your full, if you've been to that hospital and you have a record there, it gives you like the full scan of your body automatically. And then with a predictive model, it predicts like what could be potentially wrong with you, and then the nurse or whoever's checking you out of the doctor kind of goes off that checklist, so like, oh, are you here for this today, are you here for that today? And so what happens with that is what they're saying is like, hey, you may be here for a knee pain, but then you got to worry about your diabetes that you didn't know, or your pre-diabetic or your diabetic levels are really high. And so like that is the selling point. So for me, it's like, I rather go in through something like that and it tells me and it foresees based on predictions of what could potentially be wrong with me, where a doctor can say, you know what, like we should double check on this. So it's for preventative measures. So for me, and it may be nothing, right? It may be like inaccurate, it may be nothing, but I rather like have some kind of idea of what could potentially be wrong with me in the future, if and it may be wrong again, versus, hey, I'm only coming for the knee pain. That's all we're going to diagnose, right? And so that's my thought process.
No, ideally, like we would all want that, right? But currently, with as I said earlier, our healthcare budget is overinflated, right? It's not something that we can sustain the way it's going. So having a full body scan is probably too costly for anyone to care, right? But from a patient's perspective, that would be the ideal solution, right? Just to keep it short, like I read how some Americans are going to other countries and doing exactly what you said, a full body scan, a full blood work, a full everything, right? Full like skin test, and they're paying like 10 grand or something like that for like this VIP once a year check. And they're like, I'm paying 10K insurance in America. Instead of paying 10K insurance, let me just do this one big fat test in these other countries, know everything that's going right with me. But the problem is that's not happening in America. And with the expensive cost of the health insurance, health industry, that's not going to happen. And not only that, with this sort of value-based care, it seems like that might be even limited even further, right? So it all comes down to cost seems to be really driving a lot of things, even though there is a hint of quality care, right, for a patient. But if you're not going and complaining about your knee, then it's not even, the system doesn't even activate. So I would hope that that's where the future would lend to if it ends up saving money and there's this huge drive on patient care, right? We don't want it to come down to we care about you, but we're also running a spreadsheet behind. You know?
Yeah, yeah,
Uh, and so, other than like your doctor is a healer, but they're also a financial analyst, right? They're thinking about numbers. So
yeah. Can you
we
imagine?
gotta
That's
think
crazy.
about where this is going to lead to. Hopefully for the better. I guess that's what we can all hope for. Um,
Yeah, yeah.
any final thoughts,
Um,
comments in terms of where? Well, hopefully things work out. I guess that's what we would hope.
yeah, yeah. Final thoughts for me. I think as we get, since we're on the topic of healthcare and AI and all these are things, and how healthcare and Medicare is changing the world, I would say, I think it's important for us to be more aware of um, one, the healthcare system in general, like where it's heading, where it's currently at. Be more aware of what we're digesting in our bodies, right? What we're intaking in our bodies. Be more aware of what the possibilities are in the future in terms of you not doing the things that you're supposed to do now. As I was explaining, the 40-year-old me wants to prepare for the 50-year-old me. And I can't believe I'm saying I'm 40. I'm not there yet. I'm still in my late
And
30s.
last I recall, you're not 40 yet, so stop
Yeah,
worrying
yeah,
so
yeah,
much.
yeah, yeah. I'm already like in the future, which is crazy. But like, I think it just this final words is like I think it's important to go check up, right? Like, focus on your health. Like, health is wealth. I think we all say that. I think we also need to start believing it. But I also think America now is more health conscious. So I love the trend that I'm seeing. I'm seeing it on social media a lot, where people are more health conscious and really careful of what they intake in their body and the output that they have, and they're being more active and exercising. So I love that. And I would say to the people that are watching, definitely continue doing that. If you're not doing that, get on it. I'm also saying it to myself, and I need to be more consistent with that and focus on my health. So staying on this topic, I'll say definitely focus on yourself and, take care of yourself and your loved ones. How about you? Anything, any last words from you?
I mean, I totally agree with everything you said, right? You are your primary caretaker, right? I think that's what it comes down to. You take care of yourself, and hopefully, the results show from that. And where things that it's out of your control, and you're going to need, external help via doctors, via our healthcare system, use it to get the best care out of it, irrelevant of whatever value-based care or fee for service. Doesn't matter at the end of the day. If you have something, take care of it, prioritize yourself and get results, get better. But yeah, if you guys have any thoughts, comments, do share it, right? What are your thoughts about these different models? How you think it's going to impact you? Like, subscribe, and also let us know if there's any other topics that you might be interested in us chatting about. Thanks, guys.
Yep. See you next time.